proud to welcome with us now is Hawaii County Mayor Harry Kim. Hi, Harry. Good to see you.
Oh, good talking to you. Thank you for having me on.
It's good to talk to you about all these issues, especially as we head into a big weekend for Hawaii County. Tell us what you're most worried about, or at least what you're preparing for, because there's a lot of reopenings here, and your staff and your people have to be prepared for it.
Well, truthfully, today on the several meetings we had on this subject, I know what you said of being aware, cautious, and worried about the weekend, but I feel nothing but good today. The news for Hawaii Island that now this makes 8 days for the whole island not to have a positive case. That's really good. And for the whole island not to have anyone on active, that's really good, right? And for the whole island, we've never had to have anyone in the hospital except for one overnight for observation. In regards to this, I realize it may be a big problem for others. I don't think it will be. We have a task force that's been working on it since March, working with all the businesses. Matter of fact, I was in a tribunal yesterday. The head of it is a deputy director of fire department, Lance Uchida. And I read where he said they visited over 500 businesses in regards to working with them for this transitional period and the rules they have to comply with and how they can help them do it. So I think this is a symbol of a little more country than Oahu, that we have that kind of contact. And I think people are looking forward to things being opening. And I really believe and have my fingers crossed that it will not be a problem and we will address problems as they come about. And there will be adjustments, but I don't think it will be a major type. I'm hoping no major really type of problems. People are happy that things are going to be opened up. It's not just a matter of opening up. It's a sign. I'll say it openly. I've said it. This tension has been built up worldwide, countrywide, statewide for the past few weeks, just building and building, looking at all the headlines of New York, New Jersey, and other places and other countries, and now Brazil being the epicenter. All they talk about is major and tragically over 100,000 in the United States death, and over a million or so of positive cases. Now we come to the state of Hawaii. I've told the governor this, and the rest of the mayors all agree with me, that the governor, when he closed off all incoming, we shut off the valve of bringing in a lot more, positive cases here, infected others here.
Well,
And from there,
Mayor, I just wanted to ask you though, early on, I remember there was some criticism about, your delayed reaction, compared to the other county mayors. Did you regret that, or do you think you responded well, considering in the early on, we did see some early outbreaks with Kona and Hilo, but how are you feeling now about those decisions you made?
you know, that's the funny thing about it, and I don't want to cover it because it's like pointing fingers, and I don't want to go there. But everyone in the job knows it was this island that was the first in the state of Hawaii to declare a state of emergency on this. I think the governor knows, if you talk to him, it was me and this island that appealed to him that we have to work as a team. And I really don't know what they're referring to as being slow because, but any measurements we were not. We planned and responded and developed things as we felt necessary. But like, well, I'll take this for example. The rest of the islands are opening swimming pools. We're not. Not that they're right, and not that I'm wrong or vice versa. Just that I explained today that I felt that all the people I consulted, that there was a lot of questions whether swimming pools should be open. And I went on the side of being conservative, that no, we don't need to open the pools. We can open other things, and there's a Pacific Ocean there. But the reasons of not opening the pools is I felt that the reasons of the medical profession that we still don't know survival of the virus in the water, or people putting water in in the mouth as we swim, and the so-called limited changing rooms and showers. You can't keep that clean regularly throughout the day. All those are the reason why this island said no, because I said not now. And the other island said fine, and that's fine. They can handle it. I thought we could not do a good job of doing that. So there isn't there are very few things that I would have done differently, maybe a little sooner, maybe even a little later. I think the one thing that I think I could have done sooner as far as enforcing the element of the importance of wearing face masks. But at the time, in the numbers of people over here, and the information that was spread in regards to very little on how things were spread, who spread it. I'll give a perfect example of that, of decision making. I think New York, New Jersey got the blunt of it. Why? They were looking to China as a cause. And in the meantime, it was those that came from Europe. And they came because they were asymptomatic. Now we're learning so heavily that the asymptomatic may be as much as a third of the reason of people, transmitting disease. But at the time, the face mask was because of overt type of coughing and sneezing, and the amount of people on this island was very minimum in regards to active cases.
How
And
are
so
you
even
feeling about the testing now? Speaking of
yeah,
testing, how are you feeling?
yeah.
We're
Oh,
still
that's
not
great.
testing asymptomatic though.
Pardon?
I understand we're still not doing asymptomatic.
Because we cannot in regards to there's still the unknowns of asymptomatic. The only way you can do that is to test everybody. We just don't have the capability of that. At this point in this island, as of this morning, I think we tested about 7,000 plus people on this island, which is a little over 10, 12, 13, maybe more percentage of our population. I mean, I'm the number of people being tested. So that's a great improvement. But to make sure that the asymptomatic people are tested cause great mobilization that this country doesn't have capability yet. But that therein is the problem. And, in regards to asymptomatic people that we felt was no threat at all, now that we know that, and if I knew that then, I think obviously I would have made mandatory face masks sooner. That's the one thing I felt we should have done sooner if I could change that back. But in
About
regards to
antibody testing? Because that's a
pardon?
way, that's a tool that we could kind of get a sense for how pervasive this is in the community. Are you a supporter of antibody testing?
Well, yes, until you started to read about 50% accuracy in those things. And yes, antibody testing may be a major tool in regards to uh, tools of prevention or treatment. And anything of that, naturally, you've got to support. I was a little disappointed, I think everybody is that when the CDC pointed out that maybe as much as 50% of it is inaccurate. That does not mean you throw away the so-called baby with the bathwater. It means that we've got to see how we can improve it. And yes, that is still supported, but we've got to make it better.
And we talk a lot about tourism and how important it is to our communities. I know for sure, Hawaii County relies on a lot of visitors for the agriculture community and all of the small businesses there. But we can't reopen, a lot of people say, because of our protocols right now. What are you hoping to see be done to ensure tourists quarantine, visitors quarantine? Because that's a big
Well,
problem.
first of all, you hit it right on the head. When the governor closed off visitors by saying, when you come to Hawaii, regardless of where you come from, you'll have to spend 14 days in quarantine. I mean, at that time, you immediately knew, everybody knew that, geez, the average Japanese tourist, for example, which is a heavy part of our visitors industry, spent less than a week here. Now, who's going to spend all that money and stay only in a hotel? And we knew what was going to do and automatically did that. In regards to the impact of the economy here, I think it was pointed out that perhaps the only place bigger than us as far as economic impact would be places like Las Vegas, because they depend solely on visitors. And Hawaii State, we all know that the role of the visitor industry here. So our unemployment now is in at 20%. I think probably it's the highest of any state directly because of the coronavirus. Here is the problem. How do we open up our doors when we know that 100% of those infected by the virus at the beginning, and therefore spread on community base came from outside in? How do we do that when the testing procedure now have to go and reach out to those that are asymptomatic? There's only one way is to hopefully have one of two things: a testing system where you could do it on real time, very fast, obviously affordable, but that's not even a major problem, is to have the capability, or have a vaccine. There's going to be a point where this state, all the leaders working with the people, what is an acceptable risk in regards to opening up the doors? And then make sure we try to mitigate all the ways we can in regards to screening, monitoring, isolation, when we open up the doors. Because until we have a total control of who comes in to be free of it, we are making an acceptable risk to judgment that they will come back. And the only way to mitigate that is to make sure that programs on this end of check-in, of monitoring, isolation, all of those things are in place before we open up the doors.
Are you
It's
more on the conservative end of that? Were you looking to postpone that maybe toward August? Or are you on the more liberal end, which you want it to open sooner than later?
My position always been, we have two responsibilities on this, major responsibilities. Number one is the protection of the people in the state of Hawaii. On myself, obviously, the island of Hawaii.
Mhm.
Secondly, is to address the economic impact. The impact was immediate, and we're facing that now. And to do everything we can now and for tomorrow, how do we address that? And I'm just trying to elaborate how difficult that decision is, because right now, this United States alone, I would say 2/3 of the states are either just stabilizing, but they're not going down, and the other third is still going upwards. And there's countries like Brazil that's just beginning going upwards. We have to face the fact that this is not going to be over today or tomorrow or August. We have to make decisions on mitigation. We have to make programs on control and monitoring. We have to make programs on isolation and really follow through on it before we open the doors.
What about inter-island quarantine? There's a lot of talk about lifting that. Are you supportive of doing that soon, perhaps next month?
Oh yeah, that I think the people of the state of Hawaii taking this opportunity, they really should be proud of themselves and all those who did everything and suffered by closing the business of closeness and gathering and face masks and everything else. If you look at what's happening in 50 states, we're the envy. We truly are. The total number, unfortunately, was lower, but still it's a number that's tragic in regards to fatalities. The total number in regards that were positive cases is very low. And our hospitals, for the grace of the low numbers, they take our island, I think it's or Kauai, but especially ours. Our hospitals never were taxed, because can you imagine how lucky we were and fortunate that one person had to be admitted to the hospital for care? So, naturally the resources were not taxed to the limit.
Mhm.
But in regards to the whole island and your question of inter-island travel, I think we're in a very, very good position, because the number of cases, of new cases, as the state calls it, is very low on our island, and I'll speak only about our island. But look at Kauai, for example, as a good example. I think in round numbers, they went 5 to 6 weeks without one single new case. And
Mhm.
that tells you in regards to the protective measures taken and the element of the virus is not that active out there. Surely I would feel very safe in Kauai people coming to the Big Island. Now let's take the Big Island. The majority of the island of Hawaii is in the same position of Kauai as far as very, very low and limited number of new cases. But so is Maui, and so is Oahu. So inter-island travel, I feel very comfortable that with precautions of monitoring, the precautions of the airlines, making sure of they follow the same rules in regards to closeness and numbers, and we'll continue each island regardless of when we open. And I think we're all ready to review a specific date over opening. And I think it will be soon because of those things. We'll continue the governor's and local proclamations of what we have to do as far as togetherness, numbers, as far as distancing, face masks will continue. So with all of that, I feel comfortable of very soon it can be opened up.
That's good. I know a lot of people looking forward to that. There seems to
Oh
be
yeah.
just one final question for you, Mayor Kim, is just there's been a kind of a lack of or a loss of confidence amongst the public in not just some of the leadership of the different counties, but perhaps in the State Department of Health and how they've been reporting and being transparent about testing results and where contact tracing is. What would you say to maybe those critics that, have lost faith perhaps in what government is doing? It may look great with our numbers and social distancing, but behind the scenes with contact tracing and some of these other systems that we feel hasn't been talked about fully publicly, that's where all the questions lie. What would you say to those critics?
Thanks for the opportunity to address that. I understand the fear, the anxiety of what the people have been going through. I take a real good look every single day at what's happening in the rest of the world and learning from the other experts of the world. I know what you said, but I believe that Hawaii State has done as a whole. Naturally, we have to get better in certain things because some people are still not listening to those rules of togetherness, of closeness, and those face masks. But take a look elsewhere. Just take a look at elsewhere. For a long time now, Hawaii State has been in the top three as where we should aim for. I look at the heavy responsibility of the governor, for example, on making the decision of when to make the decision to close off the economy, the state of Hawaii. He knew the consequence of that. Everybody knew that. Made it too soon, and the complaints on him would have been much more. Make it too late, and the criticism would be too late. Either way, you had to pick the right time for that difficult decision, but it was made. Look at the figures before you become too critical of decision making. I don't care on me, I'm talking overall. Overall, I think decision making was good. Overall, we all learned as we went along. From the very beginning, it was pointed out to this state. This is a coronavirus in regards to a pandemic. It is new. We know very little about it. We're going to learn about it. My goodness, just look at some of the rest of the world and the countries. We learned from them. We were lucky in the sense that we learned from them. We had an opportunity. Some of the criticisms of openness, this and that, I think are valid, but some of it I respected. There were discussions. Should we reveal locations? Should we reveal names and not individual names, but clusters of specifics? Because the public wanted to know. To this date, uh, I did not mention the cluster in Kona, for example, of the company for until it was exposed. I thought that it would be counterproductive of fear, of judgmental, and those things that was not right, of the privacy of people, of medical. And there, I heard the criticism, why don't you tell us where, at least where in a town, a place, or homes, or where you putting it? And it was all consideration what is best. So the decision was made, it was best for all not to do that. And I stand by that now, and that at that time, and I still do. And those criticism, I can understand it, but for judgment of what is best for the whole of the community, I felt it best we do not. And in regards to testing, none of the criticisms of testing are justified. I know what this state did in trying to get CDC controlled it at the beginning. The state government had to go through CDC for everything on testing. Absolutely no control but that the authority of CDC. I know of calls to them. When can you send the testing to Hawaii? How much can you send? Whose fault was it that the testing that first came here after everybody awaiting it because we had zero, like many places, and it came back broken. Had to send it back to the same place for a week and then wait for it to come back. And I credit the state for not blaming publicly. They just said problems are. So the conclusion is the state, but it was not. Uh, Zero blame. And I know of the push because I pushed them. There, you ask them who was the biggest pain in the neck for them of every conference call. Where are we on testing? Can't we do more? And we have what we have in regards to testing because of their push. And we wish we had more, but the whole United States wish they had more. Everyone is hoping for a system that we can test everybody on instant type of testing. Look at the things that did come up in the market, and all of a sudden we thought that what they call the 515, meaning in 5 minutes you'll get a reading, in 15 minutes a double check reading. We're finding out that's not so accurate. When you rush on these things that generally takes time, you're going to make some mistakes and you're going to be very lucky if there are none. And they just take what we just talked about as a 50% inaccurate. Not too long ago, we thought the antibody was the answer. Now we know it's not. Nobody wants this delay in testing. Nobody. Nobody in your government wants it. Everybody wants the same thing. In most biggest impact, look what they had to do to close off the economy. They know the answer to reopening it is testing or a vaccine. And we all know that vaccine might take longer. Otherwise, it's a risk assessment. What do you open? How do you open? And when do you open? Everyone knows that testing is one of the keys to making it better to open.
Mhm. And that's
If,
why so many people were really calling for more transparency
oh,
when it comes to
but what are we asking for? Transparency. It's those things of transparency. I think is out there every single day. I'm not backing them because I should back them. I'm backing them because of truth. Every single day, the Department of Health releases in regards to information on the results of the testing. Matter of fact, I even argue with them. Why are you in a rush to release certain information when it's still questionable? But oh no, they want to, open it up. You can call in every single day and know what the results of the testing are as they get it. And they do release it. You know exactly how many numbers have been tested, how many are positive and how many are not, what the status of every positive person is. Not the exact house number, but what their status is, a quarantine, etc.
yeah. It's just, I guess the concern has been we've had a few flaws and missteps with, you know, backtracking some of the data. We had that death that, was questionable. It was originally pinned to COVID-19, but then it wasn't. So to the average person, it looked like people didn't know what they were doing because
Yeah, it looks, I'll give you a perfect example on that of my impatience too. We were given information day before yesterday that we have one increase, new, positive. And I looked at it and it just, and I asked the guy from the department, can't you just not delay the release of this now until we're sure of this, because it's going to show Hawaii Island people we have a new case and that really will impact because we make radio announcements on what the situation every day. They felt no, because the reason we will release information when we get it. And
Mhm.
so a day passes and it turned out maybe it didn't have to be released. But still, I understand why they want to release everything. And I will say this to all your audience. Every single test results is available to the public as soon as they get it. Every test that they give, the numbers, you can get it from them every single day. There's nothing that has been hidden. Yes, sometimes when you do certain things, if the information given to them is wrong, they passed out wrong information, but they correct it, and they have done that. But it doesn't mean because they don't know what they're doing. They set the goal that we will release all information ASAP. The public has a right to know. I didn't agree with some of it,
Mhm.
but
Yeah,
the
and then
crit-
you also got some of that criticism as well, right? So it's
oh,
painted for you that
yeah,
it's
that's
oh,
a turf.
yeah.
If people don't criticize me, I get very antsy. Something.
It's part of your job, right, Mayor
It's part of the turf. It's part of the turf. You take it or leave it. And if you can't accept it, don't take the job.
Kim?
Because I don't care who you do, you're going to get negatives also.
Well, I appreciate your honesty and frankness with us today and sharing your insight on how Hawaii County has been responding to this very scary virus and how it's invading our communities. So I
Uh,
appreciate your
I want
time.
to close with this to the people of Hawaii, not Hawaii Island. And
Yes.
Hawaii Island people heard me this morning on, we were in a very good condition. And I, written the notice today is thanking the people of Hawaii. Uh, all you have to do is look elsewhere. And when you see the numbers game, you know that, we've been very fortunate. And these people, every single day, I mean, I get tired of talking to the governor, to tell you the truth, and my other three mayors. I don't mean that seriously, but that's how often we communicate. And we have the total freedom of interjecting any kind of concerns. Every opportunity we have on is given to us. And we can get better. We will get better. We're learning like the rest of the world. And we're making mistakes, but we're going to learn from them. And I guarantee you there's no cover up on any of the mistakes.
On that note, thank you so much. I appreciate you taking the time from your busy day, Mayor Harry Kim, and telling us what's happening over there and your message for the rest of our viewers across the islands. Thank you so much. Mahalo.
Thank you. Thanks for talking to me. Appreciate you. Bye bye.
And that was again Hawaii County Mayor Harry Kim joining us today.